I'm Bea, I'm the Diabetes Specialist Midwife at Rotherham Hospital. So you've been asked to have a look at this website because you've recently been diagnosed with gestational diabetes. So we've put together a series of videos to give you some information and hopefully to answer any questions that you might have got. And we really hope you find it useful. So the first thing you might be wondering is, what actually is gestational diabetes and why have I got it? So gestational diabetes, which sometimes is referred to as GDM, and that just stands for gestational diabetes mellitus, is a really common condition. It's a form of diabetes that isn't there before pregnancy, but it develops during the pregnancy, and then usually it goes away following the birth of your baby. Now, during pregnancy, the placenta is producing lots of hormones which can cause blood glucose or blood sugar levels to rise during pregnancy. Now, usually the body will just produce more insulin in response to this. Insulin is a really important hormone that's produced in the pancreas, and insulin is important because it allows the glucose to pass from the bloodstream into the cells of your body where it's needed for energy and where it can be used for energy. But sometimes the body isn't able to produce enough insulin to cope with the extra demands during pregnancy. So instead of going into the cells, that glucose stays in the bloodstream, so the levels are higher, and that's when gestational diabetes develops. The first thing I want to say is that most ladies with gestational diabetes have a healthy pregnancy and a healthy baby. However, if the diabetes is not detected or if it's not well controlled, that can lead to certain complications during pregnancy and during birth. Things like bigger babies are a bit more common if you've got gestational diabetes, and that's because the extra glucose from your bloodstream crosses the placenta and goes through to the baby. So like anybody, if you're getting extra sugar, you tend to put weight on. So that's why bigger babies are a little bit more common. And we want to avoid your baby getting too big, because then we can run into problems when it comes to labour and birth. So things like shoulders, if they're a little bit on the chubby side, can be difficult to deliver. And that's known as a shoulder dystocia. The risks of that happening are quite small, but we know that it is a little bit more common if you've got diabetes and if you're having a bigger baby as well. Other complications related to diabetes in pregnancy are things like polyhydramnios, which means extra fluid around the baby. And if that's the case, then sometimes labour can happen a little bit earlier than normal, so preterm birth can be a little bit more common with diabetes. So although uncommon, there's also a very small increased chance of adverse complications such as stillbirth if you have diabetes that's not well controlled. But thankfully that is rare. All those complications can sound quite scary, but what I do want to say is that if we know about your diabetes and if we control it well, then the chance of any of those complications happening are very, very small. So, what does all that mean for your pregnancy and how will your care during your pregnancy change? Well, the first thing to say is that it's really important that you're looked after by a team of professionals who are experienced in caring for women with gestational diabetes. So from now on, your care will be provided by the antenatal diabetes team. Now that consists of myself, a diabetes specialist nurse called Carol, a diabetes specialist dietitian, and we've got a few of those that work with us, and also a small team of doctors who again are experienced in looking after women who have diabetes in pregnancy. And that team of doctors will include consultants and registrars. Your care will be overseen by one of two consultants, either Miss Gossican or Dr. Ram. And you'll usually be asked to come along to Greenoaks to the diabetes clinic on a Tuesday afternoon. And we'll usually see you in the clinic around about every 3 weeks, sometimes a little bit more frequently than that. And then we'll contact you by phone, usually in between your appointments as well, just to see how things are going and whether you need any support. If you're already under the care of a consultant in your pregnancy, that will mean that some of your appointments will change. So some of your appointments and scans will change to a Tuesday afternoon when we run the diabetes clinic. So just look out for some letters coming through the post with some new appointment times. If you're just under the care of your midwife so far in your pregnancy, obviously that means you will be given some extra appointments to come up to Greenoaks, again around about every 3 weeks usually. Because of the diabetes and because your baby is more likely to be bigger, like I mentioned earlier, we will offer extra scans during your pregnancy just to keep an eye on the growth of your baby as we go along. It's really important when you come to these appointments that you bring your diabetes notes that you're going to be given, which is a set of orange notes that I'll show you in a few minutes, and your blood glucose meter. Bring those with you to all your appointments. Sometimes when you come to clinic, you'll be seen by a couple of us. So usually you'll be seen by a doctor and then either by myself or by the diabetes nurse, and sometimes by one of the dietitians as well. Please don't worry if there's a couple of us in the room. It doesn't mean that anything's wrong. It just means that we're all looking at different aspects of your care. You'll be asked to test your blood glucose levels quite frequently for the rest of your pregnancy. And it's really important that you do this because those glucose levels will help us to make decisions about your care. There's a separate video which gives you a step-by-step of how to check your blood glucose levels using the meter that's been provided. And it's really important that you write these down for us so that we can see what the trends are. In your orange notes, there's a space for you to record these results. Page 14 of your orange notes is where you need to write them. And we ask you to test 6 times a day, so before every meal, just before the meal, and then 1 hour after you've finished eating your meal. And the targets for your blood glucose levels are written on the top of page 14 in the orange notes. And what we're aiming for is that before meals, we keep your blood glucose levels under 5.3 millimoles, and an hour after meals that we keep your blood glucose levels under 7.8 millimoles. And we know that by achieving those targets for as much of the time as possible, the risks that we talked about earlier are much reduced. So how are we actually going to control your blood sugar levels? So the biggest thing that you can do is to start thinking about the food and the drink that you have, and thinking about your diet is actually the biggest thing that you can do to control your blood glucose levels. There's a separate video from one of our dietitians which I'd like you to have a look at. She'll give you all the dietary advice that you need for you to start doing that. And as I say, the diet is the biggest thing that you can do to control your blood sugar levels. Something else that's really important is doing some form of physical activity every day if you can. We know sometimes that can be difficult in pregnancy, but any form of activity that you can do will help to improve your blood glucose levels. That doesn't have to be running a marathon or joining a gym, but any sort of walking or housework, anything you can do, particularly after meals, will reduce your blood glucose levels and improve those. And for some women, actually that's all they need to do, and that controls their diabetes quite nicely. But for lots of ladies, that won't be enough, and they may need the addition of some form of medication to help control the diabetes. Now, usually that can be tablets called metformin, which we know are safe during pregnancy, but some ladies will actually need to go on and have insulin injections as well. And obviously we give you all the teaching and education if that's needed. Now, it's recommended that your baby is actually delivered a little bit earlier than normal. And for most women, that will be somewhere in the region of between 38 weeks and 40 weeks. That's a very rough guide. And the exact timing will be discussed with you when you come to the clinic and you're seen by myself and one of the doctors. And the timing will depend on lots of different factors, things such as how well controlled your diabetes is, whether you're needing any medication to help control the diabetes, and also what the size of your baby is estimated to be as well. And of course, whether there are any other complications during your pregnancy. But we'll talk to you about that a little bit nearer the time, and we'll go through things on a one-to-one basis with you in clinic. Now, when you're in labour, it's really important that we still control your blood glucose levels. So usually your midwife who's looking after you during labour will check your blood glucose every hour or so. And some ladies may need a small drip put into the back of the hand with some insulin in, just to keep their blood glucose levels controlled during labour. Now, as I've already said, once the baby's born, usually the diabetes goes away almost instantly. So that means that all the blood glucose testing that you've been asked to do will stop as soon as your baby's born. If you've been started on any medication, that will also stop as soon as your baby is born. We'll just ask you to do a one-off blood glucose reading the morning after delivery, just to make sure that that's returned to normal. And what we do is arrange for you to have a blood test several weeks after the birth of your baby, again, just to make sure that the diabetes has gone away. Your baby is a little bit more prone to having low blood sugars after birth. This is known as hypoglycemia. And that's because during the pregnancy, as I've already mentioned, the baby's getting extra glucose coming through the placenta. And when the baby's born and the cord is cut, that sugar supply is suddenly taken away from them. So the baby is much more likely to have low blood sugars after birth. That's only a concern really for the first 24 hours or so of the baby's life, and there are things that you can do to prevent that. So having good control in pregnancy and during labour can reduce the chance of that happening, and also having skin-to-skin contact and feeding your baby as soon as possible after birth definitely helps to reduce the risk of that happening as well. And what we do encourage is for you to feed your baby very frequently for the first 24 hours. So about every 2 to 3 hours, and not letting your baby go longer than 3 hours in between feeds. Sometimes that may mean that you need to set an alarm overnight just to make sure that baby is feeding regularly and not going for long periods in between feeds. The baby will have their blood glucose levels checked, usually a couple of times, and if that's normal, then that will generally stop, providing the baby is feeding well. And we'd usually ask you to stay in hospital for about 24 hours after the birth, just to make sure that baby's feeding well and that the blood sugars are stable before you go home. Something else that you can consider is starting to express some of your colostrum, which is the first breast milk, from 36 weeks of pregnancy. You don't need to buy any special equipment for this. You don't need to buy a breast pump or anything like that. We can give you all the equipment that you need. There's a separate video which gives you details on how this can be done, and this is also something that we can discuss in clinic when we see you a bit closer to the time. It's not something you can do before 36 weeks, so if you are interested, speak to me in clinic about it and I can give you everything you need and talk you through it. The colostrum that you express can be frozen and stored until your baby's birth, and then if your baby's blood sugars are on the low side, that can be given as a little top-up. One final point to make is that if you've had gestational diabetes in a pregnancy, there is a very high chance that it can recur in subsequent pregnancies. So in future, if you do go on to have another baby, we would test you very early for diabetes in pregnancy, around about 12 weeks. If that comes back normal, we would usually repeat the test at around about 26 weeks, because as I say, it does tend to come back quite frequently in future pregnancies. Moving forward, there is a much higher chance of you developing type 2 diabetes in future. So your GP will need to offer you a blood test every year to be on the lookout for that. There are things you can do to reduce your chance of getting type 2 diabetes in future. Things like having a healthy, balanced diet, taking regular physical activity and watching your weight can all reduce your chance of developing diabetes in future. Please make sure you do go for that blood test every year. It should be roughly around about the time of your baby's birthday every year. And if you don't hear from your GP, please do give them a call and chase that up. I hope you found this video useful. Thank you for watching. If you've got any questions at all, please do get in touch with myself or any other member of the diabetes team. All the contact details are on the front of your orange notes. Thanks for watching.